Hi everyone, today we are going to discuss about HSP, that is Henoch Schonlein Purpura. It is also called as HSP. This is an old term. Now we are calling this disease as IgA vasculitis. Basically, it is a small vessel vasculitis. Most commonly occurs in children of age 4 to 7 years of age. It also occurs in adults, but the frequency is more in children. To simply remember the signs and symptoms of the disease, we take the name itself, the disease name itself as a mnemonic, that is HSP. Here H means hinge pain, that is arthralgias will be there, joint pains will be there. Hinge pain means joint pain. H stands for hematuria also, microscopic hematuria will be there. H stands for stomach pain, whereas P stands for palpable purpura and also proteinuria. These are the major symptoms of HSP. This is a classical picture of HSP, that is palpable purpura. This occurs over buttocks as well as lower extremities. Hands, arms also involved in some cases. Some patients who developed HSP, that is IgA vasculitis, will have an recent history of upper respiratory tract infections, various drugs, foods, insect bites, and immunizations. So the main basic basis of the disease is immune complex deposition. So coming to the symptoms, if the immune complex depositions occur in the skin, so we will get palpable purpura. Almost all patients will have palpable purpura, and polyarthralgia will also be there. Here there is no inflammation, and the pain is non-migrating. Coming to the GI disturbances, GI symptoms and signs will be there. It occurs in up to 70% of the patients with HSP. So it's like colicky abdominal pain will be present, nausea, vomiting will be present, diarrhea or constipation may be present in this patient. Hematochezia, frank blood in stools and mucus per rectum. And also children will have some intussusception also occurs in HSP. So coming to the important one, renal. It occurs into 10 to 50% of the patients. Pediatric age group patients will have more of GA symptoms, whereas adult patients will have more frequent and severe renal symptoms. So what renal symptoms are there in these patients are mild glomerulonephritis will be there, proteinuria, microscopic hematuria, RBC cast in complete urine examination can be seen. Generally, this all mild glomerulonephritis resolves spontaneously. Rarely, this mild glomerulonephritis develops into rapidly progressive glomerulonephritis and then CKD. As I earlier said, renal manifestations are more frequent and severe in adults. So laboratory-wise, if you see, there will be minimal increase in TLC and occasional eosinophilia. Platelets coagulation abnormalities will be normal, and IgA, serum IgA levels will be elevated in up to 50% of the patients. Diagnosis is based on clinical signs and symptoms mostly. Sometimes skin biopsy will reveal leukocytoclastic vasculitis with IgA and C3 complement 3 deposition by immunofluorescence. So rarely we do renal biopsy in these cases if the patient has very progressive renal failure. On renal biopsy, we can see a segmental glomerulonephritis with crescents and mesangial deposition of IgA. So that is the biopsy. This is the HP image that I kept. See that present over the image. So next coming to the prognosis, it will be an excellent prognosis for this disease, and mortality is very rare. So it almost resolves spontaneously without any drugs also. In some cases, we use glucocorticoids in patients who have very severe symptoms and rapidly progressive glomerulonephritis if it is there. We will start the patient on glucocorticoids, mostly prednisone 1 to 2 mg per kg per day. In tapering doses, we will decrease the dose based on the symptoms. So steroids will be very helpful in decreasing the tissue edema, arthralgias, joint pains, and abdominal discomfort. Renal disease wise, steroids are not that much helpful. If a patient of HSP develops a rapidly progressive glomerulonephritis, we should start him on glucocorticoids plus some immunosuppressants also. What immunosuppressants we will generally give are cyclophosphamide, mycophenolate mofetil, rituximab, sirolimus, azathioprine. So this is the basis of HSP, and 10 to 40% who had HSP will have a recurrence. And we have to ask the patient for follow-up every 6 months to check for proteinuria and any abdominal vasculitis like things. So we have to evaluate further. Thank you for watching.